Good afternoon. Thank you for joining the We Can Educational Series. Today, Dr. Casey Brown will present on the topic of emotional abuse. Dr. Brown is in her final year of the Child Abuse Pediatrics Fellowship Program at Children's Hospital of Wisconsin in Milwaukee. The handouts area includes a PDF of today's slides, as well as a PDF with details on the following housekeeping items. To ask a question, you can use the question pane on the control panel. These questions will be addressed at scheduled breaks. If you are viewing with a group, make sure to send names and email addresses of all attendees to Kathy Artolini for attendance tracking. And now I'll point you to the slide that you're seeing on your screen. After the webinar, you will use these instructions to report your attendance. The code probably doesn't work at this point. I don't think the evaluation actually opens up for a little bit after the beginning. So you can try doing this toward the end or at the end of the presentation. You'll also use the regular online system to complete your evaluation and print your certificate. This slide will appear again at the end of today's session. For a list of future topics, please visit our website at wichildabusenetwork.org. And now we'll proceed with today's presentation.
Good afternoon, everyone. Thank you for joining. Again, Sarah did a great introduction, but I'm Casey Brown, and I'm the fellow here in our program. And we're going to be talking about emotional abuse or maltreatment. So I don't have any relevant financial disclosures or any other relevant disclosures. And I do like to include a disclaimer in most of our talks. This particular topic, I think, and content may be disturbing for some. There are some images, and those may also be disturbing for some viewers. So we have three main objectives. They sound simple, but I think they'll find they're a bit more complicated. The first is we are going to try to define emotional maltreatment. And the second is understanding the co-occurrence of other types of child maltreatment like physical abuse or sexual abuse along with emotional maltreatment. And then the third is recognizing and understanding the impact of emotional maltreatment. Let's first go through some terminology. So I have a longer section in the beginning here, so don't panic if you have a question. There is a scheduled break about 15 minutes or so. But we're going to go through terminology and then definitions. And I want to get that under our belt before we dive too deeply into other things. So first I'm starting with something that might seem really simple, but what do we mean by child abuse or child maltreatment? And I did choose the CAPTA definition, and CAPTA is the Child Abuse Protection Act. And so this is a federal definition of child abuse and neglect, and it establishes a minimum. And we will eventually get into the definition of emotional maltreatment, but I wanted to cover this definition because I think it's relevant when we're talking about terminology and definitions. So I think many people who are listening are probably familiar with the definition, but I do want to point out that it includes emotional harm in there, presenting an imminent risk of serious harm, and comments on acts or failures to act on the part of parents or caregivers. And most states recognize 4 major types of maltreatment, including physical abuse, sexual abuse, neglect, and what they term psychological maltreatment, which would be pretty equivalent to emotional maltreatment. And just a quick reminder here at the bottom, so while some forms of maltreatment can be found separately, they can also occur in combination. And that's going to come up again as we go through the talk. So I like this other definition of maltreatment or child abuse. And you'll see at the bottom that it's from Garbarino. And I like his definition. I think it helps put a little bit of a humanistic spin on things. So he defines child abuse as omission or commission, so things we do or don't do by parents or guardians that are judged by a mixture of our community values and our professional expertise to be inappropriate or damaging. And I like this one because it can change over time, which I think if we look back to what was acceptable 100 years ago is different now. So it includes a human rights perspective, which means that the minimal standards of care for this child are being violated in ways that put them at risk. And so an example of this line of thinking would be if a child is maltreated, but they're resilient and they get through and they have good outcomes, their human rights were still violated and harm was still done, so that the maltreatment that initially occurred is not negated. And I think this will be important later as we talk about harm and risk to harm. So they're not the only aspect of child maltreatment. So let's go through some terminology. So I listed here a lot of the terms that might mean the same thing that we're talking about today, or that other papers and people in our community might use to talk about the same thing. So I highlighted in purple emotional maltreatment. That's the main way I'll talk about it. I might use the word emotional abuse, just a little easier to say as we go through the talk. But the term emotional maltreatment is one of the more preferred terms, at least at this point. The psychological maltreatment is fairly similar. There's emotional abuse, psychological abuse, emotional neglect, verbal abuse, and mental abuse. So let's figure them out a little bit more. In general, when reading papers or studies or a lot of our laws, emotional maltreatment and psychological maltreatment tend to be used interchangeably. Many papers and other organizations might single out or separate out emotional abuse and emotional neglect. So the way in literature and reading things, emotional abuse, what they mean by that is often things that we do to a child, so acts of commission. And then emotional neglect is often thought of as something we didn't do or should have done, so those are acts of omission. And so while we sometimes separate out emotional abuse and emotional neglect, they both are forms of emotional maltreatment. And in this talk, we're including both of those to mean emotional maltreatment. So I have a number of quotes in this talk, mostly because I find they say it a lot better than I could say it, but really highlight some important concepts. So the first one in thinking about emotional maltreatment is often overlooked and underappreciated, and we think one of the more prevalent, complex, and damaging forms of child abuse and neglect. So I wanted to start with that thought as we go forward. And the second quote, I think, just really stuck with me when I read it in terms of the weapons we use in emotional maltreatment. They're not visible. They're just hurting words, cold, uncaring silence, and maybe they didn't experience physical pain or sexual contact, but their consequences can be just as severe and long-lasting. So I want to carry that as we move into our definitions. So we're going to talk about, first, the path to the definition here. So there have been various definitions used over time, and I suspect some people who are listening have in their mind a number of different definitions or terminologies. And I think those different terminologies have resulted in these different definitions. And some other complicating factor to defining emotional maltreatment is there's not really a societal consensus on what being a crummy parent is, which I titled suboptimal, versus when that crosses over from kind of not being a very nice parent into being an emotionally abusive parent. And emotional maltreatment is really characterizing or describing a relationship between the child and the offending caregivers, and that can be difficult to characterize and difficult to study. So I think that's why we have so many different terminologies and different definitions. But the American Academy of Pediatrics, which is what the AAP stands for there on that second bullet, is the definition that us pediatricians like to use. So this is the definition from the American Academy of Pediatrics. And so they use the term emotional or psychological abuse as this repeated pattern of behavior by whoever's taking care of the kid. And then they have some descriptors. So this can be verbal or nonverbal, active or passive, and intentional or not. But it's interpreted negatively by the child and then can result in developmental, social-emotional, and academic problems. So let's talk about some of the wording in here in terms of verbal, nonverbal, active, passive, and intentional or not. So we talked a few slides ago about omission. So caregiver omission is a passive action. So that could be something not doing, something you should be doing, or withholding something. And the example will be ignoring, and we're going to talk about what ignoring is in the next slide. When we talk about caregiver commission, that's an active act. So it's intentional or purposeful. It may not be with intent to harm, but it's active. It's something we're doing. And the example would be spurning or terrorizing. And again, we're going to talk about what that means in the next slide. And thirdly, verbal or nonverbal, I think is self-explanatory in terms of you can imagine how verbally you could be emotionally abusive and nonverbally how you could ignore. So spurning versus ignoring. And I think it's important to remember in this definition of emotional maltreatment that, again, there doesn't have to be the intent to harm. So I apologize, I know this is really tiny and it might be hard to see, but this is one of the most standardly used tables to define emotionally abusive behaviors by caregivers. So it's nice to refer to later on. I don't expect anyone to memorize this. But in terms of spurning, these is often things we're saying. We're belittling, we're putting down, we're saying no, maybe don't cry, you're a big crybaby, so ridiculing normal emotions and humiliating the kid or singling them out in some way. Terrorizing, I like the last two bullets, I think are the most relatable, but does also include the first two. These are like rigid and unrealistic expectations accompanied by threats if not met. So you're going to stand in the corner holding that book up for 2 hours, and if you drop it, I'll beat you. So things like that. Threatening or perpetrating violence against the child or their loved ones or their objects. So some examples of terrorizing, which is a lot of threatening. Isolating, I think, is self-explanatory, but is really restricting their social interactions. You know, you can't go see someone you really like. Confinement, keeping them out of social opportunities, including schooling. Exploiting or corrupting is exposing them to things that they really shouldn't be exposed to. So it's modeling, permitting, encouraging antisocial, developmentally inappropriate behavior, like, go grab my gun, here, let me show you how to load it for a 3-year-old. Undermining their psychological autonomy or interfering and restricting with their development. So these are, I think, also a bit self-explanatory. The second to last is denying emotional responsiveness. This is detachment. I'm uninvolved. Don't bother me. I'm only interacting with this child when necessary. There's little warmth to the interaction. There's not nurturing or praise. And I think that's an important one that we have all probably seen or experienced. And lastly is a mental health, medical, educational neglect. And that's, not providing the adequate resources for this kid, not because you can't afford it, but this is, sorry you were raped. I don't believe you that, boyfriend did it. We're not taking you for mental health. Too bad, get over it. So those could be some examples. This is another chart from a Horner article that I liked. I found that the wording, it includes a lot of the similar things, but it has a wording that I found a little bit more approachable, or a little more friendly wording. And a couple of things that it added. Down here at the bottom was witnessing violence or cruelty. So it includes, in this case, exposure to domestic violence or destruction of things by caregivers. And then it talks also about inconsistent parenting, where you never know what to expect. They can't rely on how the parent's going to respond to them. So this one for me was a little bit more approachable. But again, this blue one is the most standardly used throughout the literature. So when we're going to talk about emotional maltreatment, we do need to address parenting and defining what is optimal parenting and what is suboptimal parenting, and then what is abusive parenting. So in this Wolf article, I like the way he talks about this. So you're balancing two things. I've underlined them: responsiveness and demandingness. It's a little bit technically wordy, but responsiveness is the hugging and the kissing and the reassurance and the sensitivity, accepting the child, with the demands of, I have clear expectations, here's what happens when you don't do them, and the discipline. And you need the balance of those two things for optimal parenting. And so when we're talking about suboptimal parenting, not abusive maltreatment, but suboptimal, you might see an imbalance in two different ways. So you might be overly permissive. So this is not using proper discipline. They may be drawing on the walls and throwing things and hitting people, and they're not disciplined. It's fine. And unmitigated support means they're just reinforced, they're reassured, like, oh, he's so sweet, you're doing great. And so this is not really helping the child learn their boundaries and learn what you sort of do and don't do. And so it's a little bit too positive if it could be. And the second is overly rigid or strict. So this is often called an authoritarian style of parenting. And these are lots of demands, lots of expectations, lots of do this, do this, do this, and discipline follows if you don't. And it's not really enough of praise and acceptance on the other side. So again, kind of a tiny chart, but I think a nice one for you guys to refer back to. We're not going to go through each one of these. I don't think that's useful for our overall talk today. But this shows how it can be a spectrum from the left of positive, healthy parenting style, and it gives some nice examples in terms of interactions and rules and limits and predictability and discipline versus where you're kind of dysfunctional or suboptimal here in the middle and emotionally abusive or neglectful on the far right. So I think that can be helpful later if you guys want to refer to that. So this is where our first, that was a lot of information, but I wanted to get through that and see if anyone has any questions at this point.
Casey, I do have one question posted right now. Wisconsin statutes only include an abuse definition for emotional damage, which really only speaks to that failure to seek treatment for mental health or emotional issues of a child. Do you have any thoughts on how CPS should be viewing other issues related to alleged emotional abuse? There doesn't appear to be a way for us to intervene outside of what is defined in statute.
Yes, I had a feeling someone might bring that up, and it's a great point. We are really limited in terms of what we can do and substantiate and prosecute and how we define it in our legislature. So that does limit us. I think that's motivation for us to work on changing that because hopefully as we go through this presentation we'll see why it's so important to broaden that definition. So my argument would be that we've got to really work with our legislatures and on a policy level to make some changes in that way.
Casey, that's the only question for now.
All right, we're going to keep going. So we're going to move into epidemiology and talk about prevalence, which is pretty tricky. So let's just talk about emotional maltreatment in general a little bit. So we think this is one of the most prevalent forms of child abuse and neglect, but also one of the least reported. And probably the lack of consensus around definitions and terminology is one reason that it's underreported, and that's probably reflected then in our statutes and our laws. So it's often not recognized when other forms of maltreatment are present. So often we're focusing on the physical abuse or sexual abuse and not really considering the emotional maltreatment that may also be co-occurring. And when emotional maltreatment itself occurs alone, which it can be difficult to identify and make it hard for us to intervene. And this is also a subject that's pretty hard to study. So I've got a slide here of a bunch of different data about how prevalent it is. And so first we have our most recent NCANS data. And this shows, these are screened in CPS reports. So this is sort of our bare minimum of what we know is occurring. We suspect and we know that this is underreported, underrecognized. And so we can look at NIS data on the third bullet point to get a comparable perspective that's a little broader. But NCANS data shows about 5.6 or 5.5% of kids that were screened and experienced psychological maltreatment, and about 2% experienced both neglect and psychological maltreatment or emotional maltreatment. So we'll come back to co-occurrence later, but I wanted to point that out now. And the 2010 Department of Health and Human Services data shows somewhat similar, 7.6% prevalence of emotional maltreatment in children. The 2010 NIS data, which is our most recent data, and we're getting old now, it's 8 years, but that's a little broader of a definition. And they describe about 27% of children experiencing emotional maltreatment, which includes emotional abuse and neglect. And 25% of neglected children were emotionally neglected. So these are sort of two sides of the coin there, and the data is fairly similar. The last bullet point is talking about some retrospective studies, kind of looking backwards, asking adults, and estimate that about 8 to 10% of the population, adult population, experienced emotional maltreatment as children, somewhat more prevalent in women than men. So risk factors, again, I've talked about how difficult it's been to study. In general, the assumption is there that it's fairly similar to other types of maltreatment, and to be honest, studies are lacking. And some of the studies that I did find, I've got some numbers listed for. So in homes where there's domestic violence and family conflict, there's a 35% of children in those homes are likely to have experienced emotional abuse or neglect. In homes where mental health problems exist, there was a range in the data, 22 to 44% of the time, there's also emotional abuse occurring in the home. And in homes where there's substance abuse problems, 21 to 50% of the time, children are being emotionally neglected in those homes. So there is some data showing us that we know that some of our most commonly at-risk families, these are also at risk for other types of child maltreatment, also are linked to emotional maltreatment. So single parents, poor parenting skills, and multiple family stressors are some of the other risk factors that are identified in the literature as increasing the risk for emotional maltreatment for a child. And while the biologic parent, much like other types of child abuse, is the most common perpetrator, so 73% of the time, it's important to remember it can be other important adults in the child's life, and it's not necessarily only the primary caregiver. So that's an important thing to remember as we do assessments later on. So in trying to make this a little bit more interesting, I'm going to go through three common misperceptions, and then we're going to talk about them a little bit later on when I think we will have answered them. So the first is that they don't remember. Infants and young kids don't remember the emotional abuse, and it's so much better that it happened when they're young and that they don't remember it. Secondly, for domestic violence, it's much better that they're only witnessing at least and not being abused in that home. So that is one commonly stated theme. And at least in a home, they might be cussing and threatening the kid, but that's not as bad as whooping them and beating them up. I know I had to bring in the next set of questions. Anything that's popped up yet, Sarah?
I don't have anything right now.
Yeah, I didn't think there would be, but that first section was pretty long, so I wanted to throw in another opportunity. So let's talk about co-occurrence. This is a big section. We're first going to talk about emotional maltreatment alone and then compare it to when it's present with other types of maltreatment. So kind of a busy slide, but emotional maltreatment can occur alone. Meaning it's the only type of maltreatment happening in the home. And we know from data now that it has significant negative impacts even just by itself. So the next few bullet points are supporting that statement. So in one study in adult women, when they controlled for the effects of sexual abuse and physical abuse, which is what SA and PA stand for. So when we remove if they had emotional abuse and sexual abuse or physical abuse, if we take out the impacts of the sexual abuse and physical abuse, the emotional maltreatment alone did have significant impacts on their physical health and psychological health. In that third bullet down, the study was looking at physical abuse and its relationship to delinquency. And what they found is if you were not emotionally abused, then there wasn't much of a link between physical abuse and delinquency. But when you add the emotional abuse back in, then the relationship between delinquency and physical abuse was back present. And so that made the authors of the study think that it was probably emotional abuse that was more of a contributor to the impact or relationship between delinquency and physical abuse. So the fourth one down is that is somewhat similar to the one above, but that psychological damage related to physical abuse is more related to the emotional abuse that came with the physical abuse. And if you think about it, it makes some sense that a person is not whooping and beating a child saying, I love you and you're so great. There's often quite a bit of that spurning and terrorizing occurring in a physically abusive moment. And lastly, adults with a history of emotional abuse or maltreatment, when you compare them to sexual and physical abuse, actually had higher rates of depression and anxiety. So this slide is making the case that just emotional maltreatment alone is a big deal and is not so healthy for us. So let's look a little bit about emotional maltreatment and other types of child maltreatment. And so in one study, they talked about how emotional maltreatment, while it can occur alone, it's present in the vast majority of other types of maltreatment, physical abuse and neglect in that first bullet in that study, but also in sexual abuse as well. So we know more and more that they often co-occur, and I think it makes sense when you think about it. True in terms of a sexual assault, that the words and actions and nonverbal things that are occurring are rather threatening and scary. The child might be, threatened, I'll kill your family or kill you if you tell anybody. So these events come with a significant emotional toll. So the NCANS data showed that 14% of maltreated children experience multiple types of abuse. And then another study showed that about 50% of emotionally maltreated children experience other types of abuse. I liked this study, I just thought it was interesting. This is an adult study, so this is one of the ACEs study, the Adverse Childhood Experiences study. It's older now, from 2004, but it evaluated quite a number of adults, 9,000 adults. And 25% of them reported emotional maltreatment. And if you can remember back a number of slides ago, this is very similar to the prevalence that the NIS data found. And then they asked those adults how many also experienced that reported emotional abuse. So in this study, they pulled apart emotional abuse and neglect. How many experienced physical abuse, sexual abuse, and neglect? And so you can see in that second bullet, it was quite high, the co-occurrence. And in terms of emotional neglect, still a lot present, but a little bit less. And so kind of interesting in terms of commission and omission. I highlighted here just the 2016 co-occurring data from the NCANS table. Just thought that it was interesting that they did look at just emotional or psychological maltreatment, and then included psychological maltreatment with neglect, with physical abuse, sexual abuse, and then neglect, physical abuse, and psychological maltreatment. So the numbers are not high, but they definitely, it's showing there is a good amount of co-occurrence. So back to my quotes. If nothing, I really like this one. So in the way that these different types of child maltreatment overlap, hopefully I've made that case for you, it's really important that we consider emotional maltreatment or other forms of abuse whenever any one type is suspected. And I think if we don't do that, then we're not necessarily creating an adequate intervention plan. We're not doing the right thing, or maybe not helping them in the right ways. And we'll talk a little bit more about that toward the end. And the second bullet point here is just the impact that emotional maltreatment has is rather significant. So let's talk about some of the impacts and outcomes, or what happens to children that experience emotional maltreatment. So it's been linked with problems in attachment, which is how we relate and connect with our caregivers and people around us, important people in our life, development, education, socialization, our behaviors, and psychopathology, or mental health. So I have a busy slide here. This is sort of summarizes some of the major overall impacts. And so we know that emotional maltreatment, like other types of child abuse, impacts child development. And so first, it's impairing our attachment to our caregivers as young children, so the people that are taking care of young children. They do not have a normal attachment due to the emotional abuse that's happening at home. And so that's associated with future relationship dysfunction, which makes a lot of sense. If you were worthless and unworthy and unloved, your future relationships would be very challenging. So that impairs their psychological adjustment and development, and their beliefs about themselves and about how important they are to other people and how they relate to other people. And so that impaired attachment continues through childhood and into adulthood. And we see that impacting their relationships with their peers, intimacy with their partners, how well they take care of other people and receive being taken care of, and how well that they can take care of others, sexual function, conflict resolution, and aggression. So moving over to the psychiatric morbidity, and we'll get a little bit more into the psychiatric part in a bit. There's problems with social problems, delinquency, aggression, and suicide attempts. And this kind of second subpoint here is the majority in this study, the majority of these kids had one psychiatric diagnosis, and 3/4 by the time they were in middle school had 2 or more psychiatric diagnoses. So a really big impact on their mental health. We know that it results in global negative beliefs about oneself, and that's a big piece of emotional maltreatment, is this low self-esteem. And we'll talk a little bit more about that. We see kids have increased aggression and social withdrawal over time. It's really prominent already by middle school and worsened by high school. And also important, we've been talking about co-occurrence, in that emotionally maltreated children then are more likely to experience further victimization. So we know that age matters. The infant brain is really easily impacted, but I think also very adaptable, and it's important to remember those two things. So why is it so profound in the first 3 years of life? And that's really, kids are born with some blueprints, but after that they're just filling it in from bottom to top, basement to roof, in terms of brain structure and function, and all the important functions are getting laid down in those first 3 years. So they have rapid brain growth and development. They're developing their biologic pathways, so their stress hormones, stress pathways or hormonal pathways or immune pathways, and their environment is going to influence this growth, which I think makes sense. So if you have attuned and responsive parenting, you've got a child that's going to flourish and grow. But if you have abusive and neglectful parenting, we know it's damaging the developing brain. And so this is a chart I pulled from one author, Campbell, and he's highlighting here some of the ways that these kids look as they grow. So the younger infants are what's called anxiously attached to caregivers. So they worry when you leave, but they're kind of mad at you when you get back. And so you can already begin to see in the early infants that they're not relating well to their caregivers. And after 2, sort of between 2 and 3.5 or so, they're not happy. This is they're very glum at this point. So they're not very positive. They're not very cooperative. They're not very happy. And you can begin to see this on developmental exams. By preschool, they're impulsive, they're fairly negative, they're demanding, and they can be difficult for teachers. And even by elementary schools, you can see these kids are having more difficulty with their peers, and their overall mental health tend to be more aggressive than their peers and do poorly academically. And then I think we all kind of know how teens do. It's like the ultimate endpoint of things not going well. So a lot of delinquency, aggressiveness, social problems, and suicide. So let's talk a little bit more. This is an interesting study looking at the psychological impact of the different types of emotional maltreatment. So this table that I showed you guys earlier, it looked at for people that had somatic complaints, headaches, stomach aches, pain, they were more likely, there was a connection between those and being terrorized, degraded, ignored, or witnessing family violence, and also physical abuse. And for kids that were diagnosed with borderline personality, they were more likely to have been degraded, terrorized, and ignored. But if you had somatic complaints with anxiety, that was associated with just terrorizing, and borderline personality and depression with just ignoring. So I thought that was really interesting, that the different types of emotional maltreatment might have different types of outcomes psychiatrically and psychologically. But in general, the emotional maltreatment is going to impact mood disorders such as depression, anxiety, somatoform disorders like chronic fatigue, schizophrenia, eating disorders, and other mental health problems. So in this slide, we're going to talk about factors that impact the impact, which is factors that really impact the outcomes, but I liked doubling up on it. It sounded more fun. So our early caregiving experiences are really important. Quality of those interactions, parenting, and other important relationships in a child's life. The frequency, intensity, and duration of the emotional maltreatment is really going to have a big impact on the outcomes. And there's intrinsic factors to children that help them be more resilient. So how well they cope, their self-esteem, and their disposition can all impact how much impact emotional maltreatment is going to have. And then again, our supportive relationships. This could include our caregivers, but I pull it out because these safe, supportive, nurturing relationships don't always have to be with the primary caregivers. And so if we can find some that are in the child's life, then we can help impact or have a better impact in their outcomes. And it's been kind of a gloomy talk so far, so I do like to comment that emotional maltreatment and trauma, so not all emotional maltreatment necessarily results in trauma. And so that's why it's so important that we're focusing on prevention and definitely early identification so we can help bolster those relationships in that child's life, improve their relational experience with their caregivers, assess how much, how often, how badly. These things all really matter. And then I threw in some social inequality part there as well, because this is a lot of what's putting these families under stress, is poverty, low education, socioeconomic things. These can really add to increasing risk factors for mental health problems in the home. Obviously, poverty is difficult. But that's important to consider. Have any questions so far, Sarah?
We don't have any posted.
Everyone's just like, oh, depressing. All right. So I promised we'd come back to the misperceptions. And since I labeled it misperceptions, you probably knew they were wrong. But let's talk a little bit about why. So the first is so much better it happened when they're kids, they won't remember it. And hopefully I've made it clear that actually the younger they are, the more vulnerable they are. And so children experiencing emotional maltreatment in their first 3 years of life are at the greatest risk for the most negative outcomes. So it's actually the other way around. And their brain and body remember. And again, we know that emotional maltreatment is changing the way their brain grows, develops, and stress-related changes that can be permanent if we're not able to catch it early. The second misperception we talked about was like, it's so much better, at least they're not getting hurt in the home. It's just a lot of yelling and stuff going on. And we know from studies that actually witnessing violence can be more harmful than experiencing it yourself. And that comes underneath that terrorizing aspect, where it's more scary or impactful to have something you love threatened or hurt. And so this shows that in one study, kids were present in like half of domestic violence events or episodes when police came, and the vast majority of them had direct exposure, so they saw or heard what was going on. And then I just think these numbers at the bottom are interesting. So children exposed to domestic violence are 6 times more likely to be emotionally abused. So that's really high. That's even more high than the physically abused or sexually abused. It's really important to consider both emotional maltreatment when you have children that have experienced domestic violence, and why it's so important that we screen for and identify domestic violence. The third one was the mom yelling at the son, this kind of cursing and threatening. Now you're more equipped, you have fancy words for these, those are spurning and terrorizing. And again, we talked about how just emotional maltreatment alone can result in significant negative outcomes for children. So it's not necessarily better that they're being treated in this way rather than physically abused. So let's move into how do we assess this. So hopefully you're feeling really motivated. This is really important. It's happening all the time. We got to do better. How do we figure it out? So these are some signs and things you might see on kids that have been emotionally maltreated. And there are things that it overlaps a lot with trauma symptoms. So it can be tricky, but a lot of this is going to be focused on behaviors and how kids feel emotionally. So you might have withdrawal, so maybe parents, schools, or caregivers are describing withdrawal, hostility, aggression, delinquency, they're not going to school, they're getting kicked out of preschools, self-destructive behaviors or suicide attempts, they're truant. And it's important, there's actually physical outcomes that can happen. So we can see failure to thrive in kids that have been just emotionally maltreated. It's not necessarily just the calories. They can actually not be growing well just due to emotional maltreatment. Kids might tell you, so symptoms is a little bit more what they might be telling you about. It might feel inadequate, unwanted, unloved. They don't like themselves, they have low self-esteem, they're sad. You might see depression or mood changes, and often we'll see a lot of somatic complaints, headaches and stomach aches. What might you see then in caregivers? This is from Campbell. This is a chart from that author. So you might see parents that are showing little or no sensitivity to the child's needs, or rejecting their attention, or even like physically don't want to hold them, like, you're dirty, go away, I'm on my phone, leave me be. They might be insulting, like, shut your stupid mouth. I think we've all probably been around parents that have, cussed and really put down their kids. They might refer to them as like evil or horrible. I've had spawn of the devil described to me before, which would be really concerning. When they talk about their kid, they're very dismissive of them, or they're inconsistent in how they respond to the child. So when we're assessing for emotional maltreatment, we have to have a high index of suspicion, which means we just have to remember that it can be there and think about it. And in doing that, I always like to remind ourselves, myself included, about bias and cultural sensitivity. So it's important to know the culture you work with and what some of the parenting behaviors are. Again, it may not be what's congruent with the U.S. behaviors, and sometimes that can get tricky. But we know that our poor folks and African American folks are more often targeted, charged, and screened in. So first of all, think about it, but also be aware of the biases that can exist. When we are getting a history for behavior problems or psychological problems in kids, it's really important to get multiple sources. And this can be challenging, but as much as we can, preschool, school, friends, parents, grandparents, physicians, just everyone that's interacted with the child, they may be very different at home, which is maybe where the abuse is happening, than they are in a different setting. Maybe somewhere else they've disclosed how horrible they feel and unworthy and unloved at home. Really important to be interviewing the child alone. This is always true with any kind of maltreatment. But the kinds of things we'd want to know is discipline at home, what do you think about mom and dad, self-worth, safety, and feeling loved. And then as much as possible, being able to observe the child and their caregivers together. And so physicians have an opportunity, I think, especially in pediatrics for this, and maybe our social workers have more of an opportunity. So I talked a little bit about our cultural considerations, and I was excited to find one slide with color I could throw in here. So these are just mimics of physical abuse, or things that can look like physical abuse that aren't. The two on the right are coining, and the one on the left is cupping. So I don't know if you guys remember Michael Phelps from the Summer Olympics a few years ago, but he also engaged in this cultural practice of cupping. So these are non-abusive injuries that are cultural, and just a reminder about keeping track of our cultural knowledge. So kind of moving into information gathering, what kinds of things do we want to know when we're doing an assessment and we're worried about emotional maltreatment, or how will we uncover it? So what are the discipline practices? How does the caregiver describe their kid? How are they interacting? And so the box on the left shows kind of like what social information you might want to gather, because these are some of our higher risk conditions. We know, right, if there's domestic violence in the home, 6 times risk for emotional maltreatment. So mental health, drugs, and alcohol, similar for other types of abuse, but just to remember that for emotional maltreatment, it's important to still be asking those. And the box on this box 2 at the bottom right, I think is a nice way of like, what kind of kid is Johnny, and is it easy or hard to take care of him, and what's good about him, what's difficult about him, how does he challenge you? And you'll get a lot of information from how they describe the child. So conversely, how do we gather information from the kid? So we already talked about talking to them alone, asking about discipline practices. What happens when you get in trouble? And I think our social workers are skilled at this, but I think some of us, for physicians or other folks that might be coming into contact with these kids, to remember to ask about these. And again, screening for domestic violence. What happens when your mom and dad argue, or use the names? Maybe it's mom and boyfriend, or mom and mom. But what happens when the caregivers are arguing? How are things at home? What do you like about mom's home, dad's home? Things like that. And I like this question number 6 here, which is, does anyone make you feel scared, sad, or dumb? I think that's getting to the things they might not volunteer to tell you about if they feel like, oh, I'm just horrible, no one loves me. That would be important to know. So I'm going to pause again for questions.
Nothing posted.
I don't know if that's good or bad. All right. So let's move forward into prevention. So there's a couple of ways we can be universal or targeted. So let's talk about universal prevention first. So we've talked about terminologies, definitions, how much emotional maltreatment is out there, how often it co-occurs, some of our important risk factors, how do we look for it. So what do we do about it? How can we prevent it? Or what are some other things we can do? So primary prevention is a public health term, which really means stopping it before it starts. And so this would be universally applied to everybody. So this is how do we promote safe, supportive, nurturing relationships for everybody. And generally this would be targeted toward infants and their families. And the nurse-family partnerships are a good evidence-informed example of a home visitation program that has been shown to work. So we know like programs that educate parents about kind of positive parenting techniques and about the negative impacts of child maltreatment actually have been found to reduce negative outcomes, some more than others. And I added the second part. I think schools is an opportunity we miss to really talk about social emotional learning. So that's just an area I think we could see improvement in terms of teaching at least children how to interact with each other and working on some of those behaviors. Not so much in terms of how parents and kids interact. So targeted prevention, we're going to talk about 2 different ways. But we know that families with histories of abuse or DV, mental health, drug and alcohol problems, they're more at risk and they will probably benefit from a more direct or targeted approach. So if we can identify risk factors, then we're utilizing secondary prevention. So we're targeting people we're worried about. Maybe the emotional abuse hasn't occurred yet, but they're at risk. And so that's really working with those at risk, parent and child, focusing on parent-infant psychotherapy and home visitation programs. A lot of our home visiting programs work in this way, so where we target it, but there's definitely some benefit, like I talked prior, to a more universal approach. Tertiary prevention then is treating those that are already impacted. So this is working with kids that have already had emotional maltreatment. And so I think it's fairly intuitive that you're going to be working both with the parent and child, because again, this is a relationship gone bad. And we want to work with them as soon as we can, and early intervention we know has better outcomes. So we want to minimize the impact on these kids in the future. And so the sooner we can do that, better. But important to remember that while we want to repair that relationship, the child's safety still really needs to be first and foremost. And so it might be that placement outside of the home for some length of time is better for a while. So just keep in mind that the child's safety, while we want to repair that relationship, we want the kids to be safe. We know how damaging emotional maltreatment, even just alone, is, along with other types of maltreatment. And I think we talked about that nurse-family partnership already. So I thought this was an interesting study, the 2012 one, and so this was looking at substantiated cases. So it says we know emotional maltreatment happened. And what the study was looking at was how often does maltreatment reoccur, the emotional maltreatment or emotional abuse come back again. So it found that fewer than 1/4 of families with confirmed emotional abuse were referred for services. So that was that was an unexpected finding for them. They were rather surprised about that. So 9% of families had second substantiated emotional maltreatment cases within 5 years. It might sound low, but that's just a rather, still, I mean, 10% of kids, that's a lot of kids. But one of the positive outcomes of this study was when they removed some of their other risk factors, when they took out poverty, drug and alcohol abuse, and other violence, and they went to counseling, the referral to counseling decreased emotional maltreatment recurrence, so how often they are emotionally abused again, by 54%. So that's really just saying that when they go, it's very effective. And that's counseling, in particular mental health therapy. So the other minus in this study was that other types of services didn't show the same reductions in the emotional maltreatment recurrence. So this is highlighting how important it is for mental health therapy to be established as soon as possible, particularly counseling can be really important. So reporting, I thank you for the comment earlier on in the talk about how our hands are a little bit tied in terms of how far we can take these cases, at least here in Wisconsin. But at least for us who are physicians and mandated reporters, the sooner we're reporting, the better off these kids can be. So even if it's just mental health, we know that the impacts are there. And so it's important to report as soon as we can, and remembering to include our concerns about emotional maltreatment when we do make a report. So maybe we're seeing a kid for physical or sexual abuse, and to remember to be asking about emotional maltreatment and including that in our report. And that'll help our data. So the more we report it, even if right now we're less able to do as much as we might like, our data is going to get a lot better if we can be reporting it more. So there is benefit. Detailed documentation from multiple sources, other family members, schools, preschools, physicians, wherever. So the more documentation we have, I think the better picture we're going to get in terms of what services this kid needs. And we talked about how important it is to recommend or provide mental health services to prevent future harm. And so I liked this summary here. It really takes all of us. So it's a multi-agency collaboration. And those that do it this way have had the most success in, one, identifying the children that have been emotionally maltreated, identifying them at a younger age, and more successful in helping address the social, behavioral, and emotional symptoms these kids experience. And some examples they provided were the medical providers, CPS, law enforcement, psychiatry, and schools. Again, out-of-home placement really should be considered equally for emotional maltreatment as it would be for physical or sexual abuse. So in a home where a kid's being emotionally maltreated, maybe alone or along with physical and sexual abuse, we should really consider it just as equally bad and harmful for the child. And again, safety of the kid is always paramount, and emotional maltreatment is harm. And early intervention, again, is key. And this kind of is fairly, I feel like last three slides summarize a lot of the same things, but just in summary for us, it's under-recognized and under-reported. We know that emotional maltreatment can lead to lifelong cognitive, behavioral, and emotional, physical health, and social problems. We know that our younger kids are really, really vulnerable, and that we could do a better job, I think, of including emotional maltreatment in our reports and our consideration when there's other types of maltreatment, including domestic violence, physical abuse, sexual abuse, and neglect. And in terms of prevention and intervention, really beginning with universal protection of the family relationships and trying to strengthen those relationships in kids that are already being maltreated. So that's the end. Any questions?
I have one reminder, not a question, from one of our participants.
Okay.
It just says that even if CPS is unable to substantiate maltreatment, these parental behaviors toward children could indicate a safety threat, and families can still be serviced in ongoing based on an unsafe child.
Exactly. That was nicely said. Thank you for that.
Yes.
Yeah.
Okay. Well, Dr. Brown, thank you very much for your presentation today. Attendees, again, the slide is up on the screen, so you can text that code to the number on your screen and then go to ocpe.mcw.edu to complete your evaluation and get your certificate. Hope you can join us next month. Dr. Hillary Petska will be giving a presentation on failure to thrive. Thanks everyone for being with us today.